Hello, my name is Will Courtney and welcome to Complete Connected Care. Today we're going to discuss a difficult but important topic. Cynthia.Paolillo, Lowell General Hospital's trauma coordinator, is going to tell us about Stop the Bleed, a new program that resembles CPR in that it trains regular citizens like you to potentially save a life. In the wake of mass shootings across the country, the American College of Surgeons recognized that some deaths from massive bleeding could be prevented. Cindy is training first responders, school leaders, and regular citizens on how to buy precious minutes before first responders arrive. We'll be right back with Cindy. Welcome back to Complete Connected Care. We're here with Cynthia.Paolillo. Cindy, thanks for coming.
Thank you for having me.
Cindy is the trauma coordinator at Lowell General Hospital. And how long have you worked at the hospital now?
I've been there for 31 years.
And how long have you been in this position?
For 3 years.
Okay. Tell us a little bit about what the trauma coordinator at the hospital does.
Lowell General Hospital is a level 3 trauma center, and we are accredited by the American College of Surgeons. We have guidelines that we follow to make sure that we are doing the best for the patient. And my job is to extract all of the data from the injured patients that come into the emergency department, and we put them in a registry, and the registry goes to the state, and then there's a national registry as well, in order to learn how to prevent devastating injuries.
So that's a lot of information on a daily basis. I think people don't realize just how busy our emergency room is, right?
It is. We at Lowell General, we see sometimes up to 200 visits a day. They're not all injured patients, but that's usually our amount daily.
And that's what you're putting into this database?
I just put the patients that come in that have an injury. That is, they have to be admitted or transferred to another facility if they require higher level of care, and those are the people that make the registry data.
And I like to sort of simplify sometimes healthcare a little bit on the show, that when we talk about trauma, how would you define trauma?
A trauma is an injury sustained from just different entities. A car accident would be a trauma, a fractured hip is a trauma, near drownings are traumas. So anything that would create an injury that impacts the patient's health is considered a trauma.
So we're not talking about necessarily overdoses or things like that per se?
An overdose is not a trauma. Right. That's just an emergency, and they too would require the same level of care from the emergency room staff, but it's a different level of care. Okay.
And so you worked in the emergency room for most of your career, right?
I have. I worked in Lowell General Emergency Department for 17 years, and then I moved on to the trauma coordinator position. What did you enjoy about working as an emergency room nurse? You're obviously stuck with it for a long time. I really liked the difference of the clientele that would come in on a daily basis. Sometimes you would see the same patients, but often it was just a different injury, illness, and working closely with the physicians make the job very rewarding, because oftentimes we do make a difference in the patient's health and their overall outcome.
And there's never a slow day in the emergency room.
Years ago there used to be slow hours, but now it's pretty busy constantly.
Yeah.
But that's okay, because we're pushing through quite a few patients that require medical care.
Mm-hmm. And then we're even med-flighting some to Boston, right?
Correct.
So 17 years in doing emergency room work, what made you decide to maybe step away from the bedside and become more of a administrator in a sense?
I've always had an interest in the trauma patient. When a trauma came in, I would like to be involved in that. We do get assigned on a daily basis who will be going into the trauma should one come in. And then when I learned about the trauma program and having to submit data to the state and the American College of Surgeons, I just felt like that was a good change in my career path. Mm-hmm. It's very fast-paced. heading into my retirement years, and I just felt like this might be a good change for me and still stay involved with the emergency department.
It must be interesting to see some of those trends. Were you caught by surprise at all about sort of when you looked at it as a big, a whole as opposed to case by case, were there certain trends that stood out to you?
Lowell General has just come a long way in the 31 years I've been there. We have, we can just about handle any situation. We have a cardiac cath lab for a patient that's having a heart attack. When I started there, we would have to send them emergently into Boston. We have surgeons that are available to handle the injured patient that comes in that's sustained some sort of a catastrophic event. We just have all sorts of specialties. We can keep more
patients locally.
We do, and that's kind of the goal, to keep the patient close to home, because I've had family members that have been in Boston, and it's taxing to have to get in and out of Boston to go see a loved one. So the whole premise behind that is to keep the patient near family and loved ones so they don't have to travel far.
Circle Health really focuses a lot on that close to home community setting, whether it's cancer care, emergency care, ICU. We have a brand new ICU that is as good as anybody in the state, and that includes Boston. And we've had specialists who say that this is just as good as it gets, and it's made for families, for patients, and that's the idea, right?
Right.
It's patient-centered care. Speaking about the American College of Surgeons, which if people don't know is the accrediting agency, essentially. They sign off on a lot of what we do, right? They
right.
set the standards?
Every 3 years we have a recertification visit. Our past one was last October, and we passed that recertification. And they come in, and it's a 2-day evaluation of all of our records and how we manage our records following their guidelines, and we passed pretty well. And we're due again in another 3 years, so it's just an ongoing keeping up with the standards. They change things occasionally, and we have to put it out there to the physicians, and that's part of what my job is as well, letting all of the physicians hospital-wide know what those changes are, and then I see to it that they're implemented going through my trauma medical director.
And so that's when you wonder who holds hospitals accountable. It's the American College of Surgeons, it's the Joint Commission, and we're all expected to perform at a very high level. And really,
And I think that we do a great job at Lowell General, that I have family members come there. I just think the care is optimal.
So in speaking about the American College of Surgeons, we wanted to talk today about Stop the Bleed, which is a relatively new program, right? Is it just the past couple of years?
It's been available for 2 years, but Lowell General just got on board last May. So I've been doing this for a whole year now, and I've taught over 300 participants. It's myself, and then we have a team that will go out and do the education piece.
And we want people to know that we will pass on information if you would like to have a group trained, whether you're in a workplace or a school. You're going to learn more about Stop the Bleed right now, but essentially we're talking about bleeding, and maybe I'll let you sort of describe what that program is about and why we do it.
Okay. Stop the Bleed is an initiative. It was created by first responders, government officials, and the American College of Surgeons. They all got together, unfortunately, after the mass shooting at Sandy Hook in 2012. There was a 2-year study, and paramedics were involved, government officials, the military got involved, and they realized that more of the school victims might have had a better chance of survival had people known the dynamics of stopping someone from bleeding out. If the injury is significant enough, you could bleed to death within minutes. The White House promotes and supports this endeavor, and training is underway worldwide. They reached out to me because we are part of the American College of Surgeons, and I am the trauma program manager. So they had reached out to me personally to see if I would get on board with this, and I'm very passionate about it. It's a 1-hour course, and the people that I have trained leave feeling like they've learned something. And it's not necessarily in a disaster or a mass shooting. It could be in the kitchen. It could be a next-door neighbor injures himself. Just knowing these skills can make a difference. And the whole premise behind Stop the Bleed is not to necessarily save a life, but it's to buy time. It's to buy time until emergency medical personnel arrive. So I just always emphasize that in the class, that you're not going to save anyone's life, you're going to help us prolong the inevitable so that when the emergency medical people get on board, they can get them to a hospital, get them to an operating room, and you've just initiated the save the life piece.
Right, it's that idea of a delayed response, right? So
Correct.
at a mass shooting, unfortunately, first responders don't go running in, especially if it's an active situation, and so you may have people bleeding in there. There may be a teacher or a student who could buy those precious
Correct.
minutes. And I mean, how long? What is how many minutes can it take for somebody to?
You
bleed
could
out?
bleed to death within 15 minutes. It depends on the severity of the injury and the size of the artery.
And so that could, like you say, could be just somebody cutting themselves badly enough.
Absolutely.
And an ambulance isn't right there. So, so we're talking about also a situation where obviously, when you're in that situation, somebody might say, I can't do that. I see blood and I pass out. But people don't. People would be surprised at what they are capable of in those moments, right?
And just from personal experience, as I got into nursing, I was the same way. I was very squeamish, and the first situation that you have, your adrenaline just starts going into overdrive, and you react. And then when the situation's over, that's when maybe you'll fall apart. But I think your instinct, once you've taken this course, you learn that I can make a difference. So everything else is just gone, and you just want to get in there and do the best you can.
Right, right. And if you think you can make a difference. I've been through the training. It takes, about 90 minutes?
It's
total?
less than an hour.
Less than an hour
Yes.
even, okay. So involves sort of some PowerPoint and training and then some hands-on things.
Correct.
And ultimately, to stop massive bleeding, we're talking about tourniquets and gauze, right?
Right.
So we'll show you people what that looks like.
The training we demonstrate with the tourniquet, and this is a combat tourniquet, and it is from the U.S. military. All military personnel have a combat tourniquet on their belts, and it's the one size fits all, so there's no stress in trying to figure out what size you need based on the size of the victim. And it's just a little clip in here. It velcros to itself. You put this around the extremity that's bleeding, and then you just start turning this little, I'd call it a stick, but it's a windlass, and you just turn till you can't turn it anymore. You lock it into place,
With that Velcro.
and the patient should stop bleeding. If the bleeding continues, then we go on in the course to demonstrate how to pack a wound.
Or if the bleeding is somewhere where you can't put a tourniquet
You
around
can't put a
somebody's
tourniquet,
waist or
correct.
or their
That's
neck.
right. No, don't do it on the neck. That never turns out well. There's a right way and a wrong way to apply gauze. A lot of people in the class will take my gauze and just try to shove it in my little fake leg.
Right.
And that's not the right way to do it. You have to actually get your little piece and just start feeding it in, shoving so that you're actually putting pressure on that bleeding vessel. And that's the only way to get the vessel to stop bleeding. If you need more gauze, you just keep whatever will fit in that wound is what you keep putting in.
Right.
And a lot of people don't just have sterile gauze in their car. So what the course teaches you is use anything. Use a t-shirt, use a headband, use a scarf, whatever you have to just make that bleeding stop.
And put pressure on it.
And then you put pressure on it.
So there's more to it, and we don't want people to think you've just been trained and certified and stop the bleed. There is more to this process, and it's, again, a worthwhile exercise and really can be done in a business. We've been reaching out to schools, and again, I went through it. You'd be amazed at how much gauze can fit when we do that.
Yes.
But you really want to get out there and train as many
as possible. And you've set up that we had a training session at the hospital, which was convenient for people who work. We'll come to your facility. Like I said, we do have quite a team of people that are trained to do this course. We'll come to you. It's totally free. And once you've completed the course and you've done that return demonstration, then you get a certificate.
Yep. And another thing we'll start seeing more of, it sounds like, is these kits are going to be brought around that, because again, most people don't have this thing lying around their workplace, or so if there's kits that are available that
there
you
are
can
kits.
put.
And I'm not here to plug bleedingcontrol.org, but if your facility is interested in purchasing a kit, go to the website bleedingcontrol.org. They're mounted, I've seen in some facilities that we've been to, they're mounted next to the AEDs, the automatic external defibrillators that are in just about every public facility, churches, banks, gyms. So I just think in the future we're going to start seeing a Stop the Bleed kit mounted to every AED kit.
Once we hear that this is really saving lives, and,
Right.
and the more people that do it. So, and bleedingcontrol.org is also the place where you can learn more about Stop the Bleed.
That's right.
That's the
Yes.
home site, right?
Correct.
So please think about signing up for that. You can teach how many people at a time per?
I can teach 8 people.
8 people, okay,
But
but you
if
have
there are
others.
16, I bring someone else with me. I mean, the amount of people that you have to take the course at one time, I will get the trainers there. So that's not an issue.
And who are some of the groups you've taught? I mean, literally everything from normal people like myself, semi-normal anyway. But even I've seen paramedics in that course.
Yes. Paramedics take it. Some nurses have. I've reached out to the emergency room techs. Even though we all think we know what to do, because we work in an emergency room, there's still a lot of takeaways from this course.
Right.
And I got feedback from nurses that just truly liked it. I've been to schools. Last week I went to a nursery school, and I just thought it was empowering that that group of people wanted to be on board with how to do this. And unfortunately, it's something that's out there and it's a reality.
And we've been seeing so much of it. It's
Correct.
scary. So it's scary to think that we have to deal with this, but it's reality, and
Right.
so something to think about. Let's move on to a sort of lighter topic here.
Okay.
One of the things you also do is you help with our Careers in Healthcare program, right?
Yes.
And that's a program for young people to come through. If they have an interest in healthcare, they can come and get a tour of the hospital. They can get, depending on if it's the day program or the week long, they can
Right.
they can get different access to parts of the hospital, to staff in the hospital, including yourself. And what's your role with the program?
I give the tour for the ED piece, the emergency department piece. And also, as you mentioned, we do have a week-long program in August where students come through. I do Stop the Bleed for those students during that week. I'm
they'll be certified.
allowed an hour within that week, so they could get out with having certification and Stop the Bleed. When they come through the ED, it's usually once a month, and I greet them in one of our trauma rooms. We have 2 trauma rooms at Lowell General. And what we talk about in the trauma room is how that room is all self-contained, so that if we do get a trauma victim in the emergency department, we need 2 nurses, 1 or 2 physicians, and 1 or 2 emergency room techs. We all get in the room, we shut the door, and everything we need to save that life is within that room. We have trauma cabinets with all trauma equipment for the physician to use. We have a medication room where we can also administer whatever medications are required. And then we're able to stabilize the patient. The trauma surgeon who is on call will come in, and then that's when it's deemed whether he will stay and go to our emergency room, or if he has multiple injuries that are just beyond what we're able to take care of in a given day, then we will send them to our level 1 affiliate.
Yeah, and that's so MedFlight comes in and they may go to Tufts, they may go somewhere else. It's sort of where they can
Right.
get the best care in the fastest way. And so this program, if you're interested, lowellgeneral.org, you'll find more. It's called Careers in Healthcare. Search it on Google. There's an application process. I think they're accepting applications now for the summer program. The tours go on, I think, year round. Is that
It
right?
is. It's every month.
Every month,
Until
so-
May, I think, is the last one because of school break.
Okay. So a great way to get exposure to the hospital, see what's going on there behind the scenes, and see if that's for you. Another thing I know you do is the bike rodeo every year, which is
Yes.
kind of a fun event.
Yes.
How did you get involved with that? Why is that important?
Well, it kind of came along with the job, and I was a little hesitant at first because it's a lot of gathering just a bunch of volunteers within the community. I mean, police officers, firefighters, people that work in the courthouse. I have to pull them all together. We get together and have a meeting, and our meeting is actually May 30th. And what we do is we Target in Lowell on Plain Street is gracious enough to allow us to use their parking lot. It's on a Sunday. You advertise for that.
Yeah.
And last year we had 266 participants. That's not counting the parents, because parents have to come, they have to sign consent. But we have the Lowell safety officer does a safety course, and he has stop signs and crosswalks. So these little ones are on their bikes with training wheels, and he shows them how to stop, look both ways. Lowell General supplies every participant with a helmet, because that's how important it is to prevent an injury on a bicycle. We have a DJ, we have Domino's comes with pizza, we have craft tables. The Lowell Boys and Girls Club come, and the kids there do games with the participants. And the Kiwanis Club, their volunteers come and do the registration piece. So it's just a really fun day. It's a 3-hour event, and I'm telling you, it goes by very quickly.
I bet. And somebody might say, well, why is an emergency room professional and a trauma coordinator involved in that? But unfortunately, head trauma is a real thing. Helmets are there for a reason.
Right.
We can say, well, when we grow up, we didn't have them,
Right.
but that the emergency rooms, we're seeing a lot more head injuries. Why is it's not just about having a helmet, right? There's more to it. It's fitting right.
Well, we do have nurses that do come. They come to volunteer, and they have been trained on how to properly fit a helmet. You'll see some kids, like even in my neighborhood, I'll be like, hey, get over here. Their helmet's like hanging off the back, the strap is loose. You have to push it up and make sure that it's seated just right, and then tied very tightly. And that's why the parents' participation is also pretty key in this little rodeo we have, so that they understand the proper wearing of a helmet.
Make it fun for the kids, but informational for the parents,
Right.
because the ultimate goal is to get these kids wearing helmets.
Exactly.
Getting them wearing. Is there a time you should or should not wear a helmet? Is there a rule?
Never.
Yeah.
Anything on wheels outside of a car, you should wear a helmet.
Scooters.
Anything.
Yeah.
Anything that has wheels.
Yeah. It's and because unfortunately, I'm sure you've seen the head trauma is
Correct. Concussions, it's not a good thing.
and we've learned so much about what traumatic brain injuries are about. And so essentially, what we're trying to do at Circle Health is treat the patients. That's what we do. But a lot of this proactive work is an important piece of what Circle Health wants to do, whether it's urgent cares and everything else. We're trying to, as Jody White, our CEO, likes to say, we're going upstream in the healthcare process. But I would think having all this experience, being able to educate people and getting out in the community must be kind of fun.
It is. It's a lot of fun for me, because I just get to meet so many people. And I think just my own family, teaching them how to prevent an injury is just paramount. Injuries are accidents. They're not on purposes. So if you can teach someone how to prevent an accident from happening, then that injury won't take place.
Yeah.
And a few years back, we did Kids Don't Fly. And that whole promotion were screens. Little ones are like looking out a screen. The screen pops out. The little one falls out. Many years ago, I'd say we would have 2 or 3 a year. We haven't seen, knock on wood, the time of the season's coming. But I think just with getting it out, getting the word out there, that you have to be cognizant of that little flimsy screen isn't going to keep your toddler in the house.
Right.
So we did some promoting with that, and it seems like it might be somewhat eradicated, I'd like to think.
Right, well, and maybe you have to remind people. That's one that I don't think people think a lot about when we're
Right.
getting into the summer months. My wife is a nurse, and I when I married, I was sort of this laid back, kind of carefree, and, seatbelt, whatever, and obviously seatbelts, a lot of this, seatbelts was deemed a public health crisis, and that's changed significantly, right?
Correct. That's where all of this data that I input to the registry is what prompts a study. So that's how seatbelts were born. That's how helmets on a motorcycle were born, and then it trickled down to helmets on a tricycle. So that's what the data is all about, that, how to prevent an injury. So
See where these things are happening and
That's
how
right.
can we do something about it. And obviously the Stop the Bleed is a big piece of that now, unfortunately, with gun violence.
Right.
the fact is, listen to an emergency room nurse, because nurses have seen it. So you say, well, could this go wrong? Oh, it's 1 out of 1,000, 1 out of 10,000. You see the 1 out of 10,000,
right.
and you see what it does to the family. You see what it does to that individual. We're close to out of time, but it is Nurses Appreciation Week. This week happens to be. So maybe you could just tell me a little bit, as you say, you're getting near retirement years, which I don't believe you, but you're going to be around for a while. Why did you become a nurse, and what have you enjoyed about it? If somebody's thinking, I'd like to be a nurse one day.
Nursing is like a million different professions. If you go in and you get your registered nurse degree, you can be anything. You can be a pediatric nurse, you can be an OB nurse, you can help a doctor deliver babies, you can work in an emergency room, you can work in a nursing home. So it's a very diverse profession. Once you get your degree, you can start out on a medical surgical floor. That may be your niche. You may want to go on to an intensive care unit, and that's what I did when I first started. I went right into intensive care, and it's like building blocks to your knowledge of being a nurse. And
there's so many different paths, right? When you enter nursing, as opposed to, I've heard people talk about becoming I want to be a physician assistant. And my wife will say, well, think about nursing, because there's one track on physician assistant, or it's a small one, whereas nursing you can do so much.
Nursing is and if you feel as though it's just not rewarding enough, because nursing is definitely rewarding. When you see a patient who comes in and they're very ill, and then you're able to discharge them to a loved one to take them home, that's just made your day. I mean, that's what it's all about, saving a life and making a difference in someone's life.
Time goes by quick every day, right? You're not sitting behind a desk. And there are even nursing quality jobs. I work nearby a bunch of nurses who are really just out measuring quality, and they're not necessarily bedside anymore, but one thing I've learned, never tell a nurse she's not a nurse. Every nurse is a nurse.
That's right.
Whether
Absolutely.
they're the CNO or the person on the first day on their job. So thank you so much. I told you, it goes fast.
Oh, thank you.
It's Cynthia.Paolillo, trauma coordinator from Lowell General Hospital. Again, if you want to do Stop the Bleed, we really encourage people to reach out to Lowell General Hospital. We will supply the information here on your screen. But that's it for now. Thank you again.
Thank you for having me. I appreciate it.
All right, and we'll see you again on the next Complete Connected Care.